So third tumor we'll see will be a pilocytic astrocytoma. This is going to be the most common primary benign tumor seen in the child. And here it is going to be of WHO grade 1, a very low grade tumor which has a good prognosis. And here again, the most common site will be a posterior fossa like that of a medulloblastoma. And the classical radiological feature which defines a pilocytic astrocytoma will be a cystic lesion with a mural nodule. So when they see this, they give a bang-on diagnosis of pilocytic astrocytoma. So radiology is classical for a pilocytic astrocytoma. Microscopically, you can see pyloid cells. So as the name suggests, pyloid means there is going to be some hair-like processes. So the cells will appear loose with pyloid-like processes. And though along with that, you can also see rosenthal fibers, which are some pinkish material like this. So pinkish fiber-like material will be present. And also eosinophilic granular bodies, which are again pinkish material, which are appearing like granules, like smaller rounds. Okay, eosinophilic granular bodies and rosenthal fibers can also be present. Though not specific for pilocytic astrocytoma, they are commonly associated with pilocytic astrocytoma. So next tumor will be oligodendroglioma. Oligodendrocytes are also glial cells, and here from that also we can get a tumor. So here this is a glial tumor in which is defined by the IDH mutation along with 1p19q co-deletion. So when you have IDH mutation along with this 1p chromosome 1p and chromosome 19q co-deletion, you can call it as a oligodendroglioma. Okay, IDH we all know it is isocitrate dehydrogenase which was involved in oncometabolism. Remember, so this IDH is going to be mutated in oligodendroglioma as well. And the classical morphology of oligodendroglioma will be, it is going to be composed of this cells which have a perinuclear halo. So all of these cells, if you see here, it is having this blue part is the nucleus. Surrounding it, you are going to have this halo. So this kind of perinuclear halo is going to give these cells a fried egg appearance. So where else did we see fried egg appearance? Yes, in oligodendroglioma. Then we also saw it in hairy cell leukemia and also in chromophobe RCC. So chromophobe RCC also had this perinuclear halo with a racinoid nucleus, right? So fried egg appearance, we can see all these conditions. Along with that, in oligodendroglioma, you can also see the presence of these chicken wire vasculatures, very thin vessels in between you can see, and these are going to appear like chicken wire. So that is why it is called as chicken wire vasculature. So fried egg appearance with chicken wire vasculature and calcification are components of this oligodendroglioma tumor. Then moving on to the next tumor, which is ependymoma. So ependymoma, ependymal cells is the origin, and ependymal cells are the cells which are seen lining the ventricles. So the most common site of this tumor will be in the fourth ventricle, and also in adults it is going to be common in the spinal cord, and it is associated with neurofibromatosis type 2. So there are certain tumors associated with neurofibromatosis type 2, and one such is ependymoma. Then other than that, we can also have schwannoma and meningioma, which we'll be seeing in a while. So since it is lining the ventricles only, here from there itself, the tumor can directly enter the CSF and dissemination can happen. So CSF dissemination can also be seen in ependymoma. Other than that, we saw medulloblastoma had drop metastasis into the CSF causing dissemination. So this is the classical image of a ependymoma. So the ependymal cells are actually forming these rosettes. So if you appreciate this, it is going to, this is looking like a flower, this is looking like a flower, this one is looking like a flower, this is looking like a flower. So all of these are forming rosettes. While this rosette is having an empty lumen in between, this is going to be a true ependymal rosette. Okay. While this is this another thing here we are going to see this vessel is there in between. So here also we are having a vessel in between. Here again we are having a vessel in between. So these are the pseudo rosettes which have a blood vessel in between. So both true and pseudo rosettes are present in ependymoma.